Hello and welcome. Low back pain in a Jiu Jitsu athlete, extremely common. The most common cause of low back pain is an acute lumbar strain, a muscle strain. But there are other possibilities that I would quickly like to make you familiar with. If you suffer an episode of low back pain, the first thing you should do is examine the skin. There are 3 skin conditions that can be extremely painful. Number 1, an abscess, which is a pus pocket. You will feel it raised, hot, red, tender, swollen. Feels like a collection of fluid underneath the skin. This can be very painful. A second condition is cellulitis, an infection of the skin without a collection of pus. Again, the skin can be hot, red, tender, swollen. A third possibility is shingles. Shingles can be very painful. Underneath the skin, we have several layers of muscle, and of course, one of the most common causes of low back pain in Jiu Jitsu is a strain of one of those muscles. Underneath several layers of muscles, we have the bony anatomy. The vertebral column, vertebral body, disc, etc. Pelvis, hips. Arthritis in any of the structures can cause chronic low back pain. Another very common cause is either a bulging or herniated disc, which bulges back, irritating the spinal nerves that leave the spinal cord, can cause chronic pain. Beyond that, you also have to think of the GI system and the genitourinary system. For example, the GI system here, if someone suffers from chronic constipation, that can cause chronic low back pain, or inflammatory bowel disease such as ulcerative colitis or Crohn's disease. If a younger athlete has active lesions lining the intestinal wall, that can cause chronic low back pain. Of course, the genitourinary system also. A bladder infection in males and females can cause low back and pelvic pain. Dropping a stone from the kidney into the ureter where it gets stuck can cause severe flank and low back pain, especially sometimes after an intense training session where we get dehydrated. In younger female athletes, certainly endometriosis can cause low back and pelvic pain. In older female athletes, fibroids, little meaty outgrowths that are growing in the uterus, can cause pain. So the point of this video is that yes, most likely it's a muscle strain, but you also have to think of skin, bone, gastrointestinal, and genitourinary causes, and always see your doctor for a proper diagnosis.